So my niece was born at Christ. She was preemie, and she was there for about the first two and a half months of her life. So for me, it was just like kind of like a full circle moment to be able to come back to a place that I was so familiar with. I used to visit her all the time. Plenty of family members and friends got treated at Christ. So I feel like, that was kind of the more personal reason why I chose Christ.
And so I got to know a lot of the residents really well. I got to know the faculty, got to work on the inpatient team. And I just really, really enjoyed meeting everybody and enjoyed, I really liked the relationships that, how well we all get along with each other. And I think that was something that was very important to me when I was looking for a residency program.
Not all the places have a very wide, diverse variety of patients that you get to see, which what I think is what family medicine is all about. So I really like that.
There was just so many different specialties and so many different other residency programs in the hospital that actually was a huge bonus for me, knowing that it was a huge teaching environment. And having rotated through different services at Christ as a student, just seeing how teaching focused it is and how kind everyone is to the residents, and knowing that you just had, you had other people to look to work with that were, in a similar situation all across the hospital.
Each of the faculty kind of has their own niche in what their strength is, so you can learn a lot from each one of them. And some of the attendings have been there or have been in practice for more than 25 years, so you can hear a lot of experience, and some of them are very new, they're just out of residency, so they're easy to relate to in that sense.
Whatever you have an interest in, you're able to easily do throughout our residency. If you have an interest in procedures, we have enough procedures for everyone.
We would like that life is just linear and just kind of goes straight, but sometimes things happen. And I feel that, I've been very supported. Through me personally, I've had issues that I faced through residency, and to know that I have the support of my program is huge.
It's a very busy hospital. You definitely get your numbers, level 1 trauma center. So you get to see a lot of exciting things. And then the best thing about it too, now being in the program is, as you rotate through ER, OB, peds, everywhere, a lot of times I've had the attendings approach me and say, if there's something that you're interested, or if there's something you really want to see, let us know and we'll get you in there. So it's really nice that they really protect your learning, and they try to get you to see the things that you really truly are interested in.
They have such an array of backgrounds in terms of their training. So that really interested me because I knew it would allow me to get exposed to a lot of things during my training. So after training, I could kind of figure out what I wanted to do with my life. I also love the residents. Everybody's so friendly and kind toward one another, and they're always willing to help you out when you're in need.
Also, the diversity of the patient population, not only in just ethnicity and where they come from, but also in pathology that we get to see here at Christ. And I'm already seeing it now, second month of intern year, just amazing pathology that I didn't think I would see. When I decided I wanted to do family medicine and I started rotating at Christ, it actually put the family in family medicine, and I knew right away this is where I wanted to be. And here I am.
I think what I enjoyed the most is you guys. Our class has been so much fun, and we have grown through so much now that we're third years, which is crazy. But just having you guys, the support of you guys, and I think we just get along really well. That was very, very important to me when I was looking at programs, because I was I'm going to spend 3 years with people constantly, basically seeing them more than I see, my own family. And it's been really, really great to have a class that I get along with.
The people, for sure. First of all, my intern class is so fun. We've only known each other for a short time, but I already feel like these guys are gonna be lifelong friends. And even the staff, I'm never afraid to ask a question, even though I know I'm gonna sound like an idiot. It doesn't matter. I know I can go to them for help whenever I need it.
Having other residencies in the hospital, you are treated as part of their residency if you're rotating on there. And that means you're getting the full teaching that you would get. I feel like I'm a part of the team, even though I'm family medicine in a peds rotation. I am a peds intern for that day, and I'm getting the full exposure as they would be getting as well.
One of the strengths is definitely the people. Not only do you have amazing residents you get to work along, the specialists are really awesome, and they're really excited to teach and help you out. I actually just got a page from one of the specialists answering one of my questions. I feel like there's no such thing as a dumb question. I'm never afraid to reach out. They're always really helpful.
The fact that we have our own group text that we can constantly always, we have someone to text at all points of the day, even during nights, we always text each other and stuff like that, and enjoy the fact that like you guys understand what I'm going through and we're all kind of going through it together. And I think that's what it makes everything so much better to know other people are suffering with you. But no, I really do. I really, really love our class, and I love the bonds that we've formed. And I think it's one of my favorite parts about being in this residency.
I've grown all across the board in terms of, medical decision making, but also just being confident. I feel like as an intern, you want to please the patient. You want to do, everything in the room, and you just have to learn, what is the best use of your time. And so I feel like I've done a great job of being able to, listen to our attendings and kind of focus on the needs of the patient at that moment. I just feel like across the board, I've just been able to grow. Confidence has increased. And it's crazy because I feel like you just look up and one day you're just like, oh man, I feel like a doctor. It's like 1 minute you graduate and then you're a doctor, and it's like, well, that's weird.
That's what I was going to say.
You'll like it. And it's like, hey, I did some good doctoring, right?
I was going to say confidence. I feel confidence has grown so much from when I was a fourth year medical student, just graduating and starting residency to third year. I feel so much more confident in my decisions in medical management. I've definitely also embraced like kind of this like lifelong learning. Like I need to, studying doesn't end when the test ends.
Yeah, I feel like I've learned to become the type of doctor that I want to be. Which I think coming into residency, I was like, I don't know, I'm just going to do what everybody else does or do what I learned from the person that I shadowed as a med student. And so I think it's been really cool to like work with different attendings, work with different residents, even just working with different seniors. You just kind of get to see how people do things. And I kind of picked up on how I want to practice in the future. Like now that we're starting to slowly think about finding jobs and stuff like that, it's just crazy to like be like, wow, I actually feel pretty comfortable. I'm gonna be a doctor and I feel pretty good about it. It's crazy to think about where we were day one, not knowing anything, to now like managing our own OBs, it's crazy how far we've come, like seeing how each and every one of us has changed in the last 3 years. It's amazing.
I agree. And I don't think that I could have come as far as I have without the support of the program.
Now this is the way as you walk up the stairs. We always take the stairs. So as you walk in, there's different pods. Our family medicine clinic is actually pod F, all the way at the end. It's purple. The thing about this building is not only is there family medicine residency, but now there's a new incoming OB-GYN, there is pediatric, acute care, all different types of specialties that you can find here. They even have general surgery on the first floor. So a lot of times we could send our patients here within the same building when they want to see a specialist.
So I'm going to show you one of our regular exam rooms in clinic. This is a pretty good setup here. It's nice and spacious. They're all pretty much set up the same. The MAs can do our height and vitals and weight inside the room already. We have a couple of chairs for our patients if they have family members who want to come in. Every room also has a computer that you can move around so you can adjust it whether or not you're facing the patient, just to make sure that you're comfortable in the room. Every room is set up pretty similarly in terms of having the sink in the room, your gloves up top, all of your equipment here. All the drawers are also fully equipped with any additional materials that you may need throughout your visit. And this is all stocked by our lovely MAs. So if there's anything that's missing or anything that you need, our MAs are on hand to restock for you.
I'm going to show you one of our procedure rooms, so you can come on in here. It's super spacious. And it has a lot of equipment here up top, anything that you can possibly need for any type of procedure. So you do really get a great experience when it comes to procedures.
So next we're going to show our precepting room. This is where we get to talk with our attendings one-on-one about the patients that we see in clinic and talk about our assessment and plan for the day.
Sectioned off pods, and so family medicine works on 2 different pods. We have half of the team here and then half of the team on a pod on the other side. Just exactly the same as this pod.
This is just an overview of the pod. We have residents working on the side there, and then on the right side you can see that's where our MAs are working, and in the middle pod is where our nurses usually sit, and they can triage patients, they can see patients for nursing visits.
Welcome to the resident workroom. This is where we come in and we do a lot of our pre-charting. We come in here on breaks to chit chat. We have our lunches here. It's a very spacious area.
White coat or fleece?
Fleece.
Fleece all day. I say
White coat.
I definitely
Our fleeces look really good.
I would say definitely the white coat. I get mistaken as a nurse all the time. White coat will be the answer this evening.
I am definitely a fleece man myself, I must say.
I prefer the fleece too.
I would say white coat for me because sometimes I'm just looking a little younger.
Yeah.
I was gonna say, can I wear the fleece under the white coat? Because I'm always.
Call room versus resident lounge to sleep.
Oh, resident lounge.
Resident lounge.
Resident lounge, yeah.
The TV's bigger in the resident lounge.
That's
Agree. That's why I pick it.
What do you guys like to do outside of work?
Right now, we don't really have a life outside of work.
Sleep.
Eat. Sleep, eat.
Those would be my 2 answers: sleep and eat.
We'll see you guys in the fall.
Bye.
Bye.